Now today I am going to discuss the ocular inserts, which is a frequently common questions from ocular drug delivery or ophthalmic dosage forms in the parenteral. The ophthalmic inserts are basically the sterile solid preparations with a thin, flexible and multi-layered structure for insertion in conjunctival sac. Now see the structure of ocular insert. It is called as ocuserts. It consists of four rings. The outer two rings are called as rate controlling membrane, which is transparent, and in between two transparent rate controlling membrane, we are having drug reservoir and the annual ring, which surrounds the reservoir opaque white for visibility in handling and insertion. And is the structure of ophthalmic ocuserts. And why so it looks like this contact lens, and why we are going to use ocular inserts? Because it increases contact time and improve bioavailability, providing a prolonged drug release and better efficacy, reduction of adverse effects, and reduction of number administration, and thus better patient compliance. Now the inserts are of two type. One is insoluble inserts and soluble inserts. Now, insoluble inserts are a multi-layered structure consist of drug-containing core surrounded on each side by a layer of copolymer membrane, as we have seen, and which drug diffuses at a constant rate. The rate of drug diffusion is controlled by the three parameters. One is polymer composition, second is membrane thickness, and the third is solubility of the drug. Now, in the ocuserts, it is available in the market as a below 20 and below 40 ocular systems. The meaning of this below 20 and 40 is it delivers 20 microgram per hour of the drugs, and below 40 delivers 40 microgram per hour of drugs, and specifically below stands for its pilocarpine. These ocular systems are placed into the inferior cul-de-sac between sclera and eyelid, and the release pilocarpine at a steady rate for 7 days in the treatment of glaucoma. Like this, we have to place ocular inserts in our eyes in the lower cul-de-sacs. Now, second is soluble inserts. It consists of all monolithic polymers devices that at the end of the release the device dissolves or erode. Now, depending upon the type they are made based on natural polymer. The first, it is used as a collagens based on synthetic or semi-synthetic polymers. Examples when they are prepared of cellulose derivatives like HPC, methyl cellulose, PVA, EVA, ethylene vinyl acetate copolymers. The system softens in 10 to 15 seconds after introduction into upper conjunctival sac and dissolves within 1 hour while releasing the drugs. Advantage: being entirely soluble, so they do not need to be removed from the site of application. And so these are called as soluble. Solubles, again I repeat, soluble based on natural and semi-synthetic. And if they're natural, then they're made up of collagen. And semi-synthetic, then the semi-synthetic polymers like cellulose derivatives are used in the soluble inserts. The examples of soluble inserts are lacquericert. It is a sterile insert used in treatment of mainly for dry eye syndrome. So it will give you, when the patient is unable to give the symptomatic relief with artificial tear solution, then the doctor recommends this lacquericert. What does it contains? The lacquericert composed of 5 mg HPC in a rod shape structure with about 1.27 mm diameter and 3.5 mm long insert is there in case of the lacquericert. Now, other than these intraocular dosage forms, they are ophthalmic products that introduce into the interior structure of the. So these are about inserts, basically ocular inserts, right? And other than these, you are having the intraocular dosage forms, which are introduced into the interior structure of the eye during ocular surgery. They need to be sterile and paragen free, and strict control of particulate matter, and it should be compatible with tissues. It should not give irritation, and it should be packed as a preservative free single dosage form because it will irritate. So intraocular dosage form, it includes first irrigating solution, which are used in the, it contains various essential ions: potassium, sodium, calcium, magnesium, and chloride, and it is formulated to be isosmotic with aqueous humor and must be non-paragenic, similar to the injection first. And second is intraocular injections, when the dosage forms like steroidal and anesthetics or anti-infectives. To achieve high therapeutic concentration intraocular, they have to be given in the form of injections. So FDA has approved intraocular injection like miotics, antiviral, or for intravitreal humors. And one of the again intraocular is implants. They includes ganciclovir or antineoplastic drugs in a tablet, magnum stearate, and is coated to retard release with PVA and EVA polymers. These devices, when surgically implanted into vitreous cavity, release the drug over 5 to 8 months of the period. So these are called as the intraocular dosage forms, ocular inserts and intraocular dosage forms.